Well, a new patient phone call is very important to the practice because new patients are the lifeblood of a dental practice, and that initial phone call is the first impression of your practice and your team and your dentistry. And so it really starts setting the tone for the relationship of that patient that they will have with your practice. And so it's really crucial to make those connections on that first phone call. And that first phone call really starts setting the stage for everything that they're going to do in your office and all of the patients that they will refer to your practice. So it's really important that we make that first phone call a home run. And we want to show them and demonstrate to them that we are very caring and that we're unique and that we are distinctive, because you know the old saying that patients don't care how much you know until they know how much you care. And so making that first impression is really, really important to getting that new patient in the practice. Well, some potential patients may be shopping for various offices and comparing and calling several offices through the phone book or through the internet, and they may be trying to find a good match. So they may be shopping your practice, which is also why it's so important to make that good first impression. They may truly not be a good match. Maybe they're looking for services that you don't provide in your practice, and so they may not be a good match for your practice, and you certainly don't have to be everything to everybody. The other reason that patients may not schedule is they may feel rushed or they may not feel that they've been listened to. So using some of the tools that I'm going to share with you in just a moment really help your team make sure that that patient is a good match and make sure that they feel heard and that they feel comfortable. And even if the patient is sort of on the fence about coming to your practice, I want your team to feel that confidence for them to ask for them to schedule. Mrs. Jones, would you like to schedule an appointment to meet Dr. so-and-so? Because when they do that, then that's helping that patient, that's that call to action. It's helping that patient make that decision and reassuring them that, hey, you have called the right place and we will take great care of you. And so truly the best referral sources are your existing patients. And when you get a referral from an existing patient, those patients already know you and they already trust you. And so patients that come from other patients are usually ready to schedule at that point because they already have some relationship with you. So even if a new patient, a potential new patient says, you know, I'm going to call some other offices or I can't schedule right at this moment, the key is to have your team leave that door open and say to that patient, Mrs. Jones, would it be okay if I follow up with you in a few days to make sure that your needs have been taken care of? Because then that patient's going to realize how much that your team truly does care and that level of support that you provide in your office. So, you know, even if they don't schedule, it doesn't mean that they won't ever schedule. Well, I'm a follower of Linda Miles, and Linda Miles says to hire, train, trust, and praise. And truly the investment in your team, in training them and teaching them the skills, communication skills and verbal skills and phone skills has a huge return on your investment. And really after that initial training, so if you have a new team member after that initial training, that ongoing training and coaching and feedback is really, really important. And there's a couple ways that you can do that. One way is you can utilize some technology like recording the calls so that we can use those for coaching each team member, and that's been very, very effective because a lot of times we say things that we don't even realize that we're saying. And so then the other piece of technology or equipment that we use is a new patient call sheet, and I'm happy to provide that to your listeners. But it allows the team to gather the necessary information as well as start building that relationship that will be an ongoing relationship. One other suggestion that I have is to print that in a very bright color so that if any other team member walks up, they know that that team member is on the phone with a new patient, and that's a do not disturb zone because they are gathering vital information and building that relationship and making the first impression of your practice. Yes. Good question. Lots of offices say to me, I have this problem, patient schedule, and then they break their appointment or they no-show. Well, one of the best ways that I have found is confirming their appointment through the technology like Smile Reminders, Demand Force, your Dentrix software, EagleSoft. So confirming those appointments. Then also the other key piece is building value for that appointment, reinforcing how important it is that they show up and that your dentist is a rock star and that they have called the right place and that they will be so glad that when they come in to meet your dentist. And then build that excitement. We all look forward to new things, and so building that excitement on the phone that they want to come in versus just being, humdrum, it's another appointment, but building that anticipation for the new patient. And one of the best ways that I have found that has worked is that each week my team gives me a list of all of the new patients that I will be seeing, and I call them before their appointment. It's a very brief call, but it goes something like this. Hi, Mrs. Jones. This is Tanya Brown. I wanted to let you know how much I'm looking forward to meeting you tomorrow. Michelle has told me that you are interested in and I'm looking forward to meeting you. Is there anything else that I can have ready for you tomorrow? And the patient, maybe will lead into some other things. Do you know how to get to our office? Have you filled out your paperwork or your information online? Yes, great. I look forward to seeing you tomorrow at 2. And that reinforces, and patients are very, number one, impressed that the dentist is taking the time to call them, but it reinforces that your team communicates with each other. So that information that your initial team member gathered, now that's been communicated that that patient was actually heard and listened to, and that was communicated between your team. And then the last piece of that equation is that in the morning huddle or in the morning debriefing, I share what additional information that I may have gathered from that phone call and share that with the team so that when my new patient coordinator meets that patient, now that's come full circle from that initial phone call to my initial contact to now that patient's first visit in the practice. And that's very, very powerful. And we really have reduced our new patient no-show rate to almost nothing.